High blood pressure, otherwise known as hypertension, affects an estimated 1.2 billion adults between ages 30 and 79 years worldwide. And of this number, two-thirds live in low and middle income countries like Nigeria. According to the World Health Organization, hypertension is a major cause of premature deaths worldwide, affecting an estimated 1.3 billion people while killing approximately 10 million yearly. Sadly, while 46% of people living with high blood pressure are not even aware that they have the condition, only 21% adults have it under control. Welcome to Talking Health, your go-to program on health matters. I am Bumi Idowu. What is high blood pressure? Or when is one said to have it? How does one even detect it? Is it hereditary? Back on the show with us to enlighten us is Dr. Adora Enyi, co-founder and chief operating officer at Oncopadi Technology Limited. Welcome to the show, Doctor, and thanks for joining me.
Thank you for having me.
Thank you. Okay, let's begin at once. Doctor, when is one's blood pressure actually considered high?
So the blood pressure is measured in two parts. We have what we call the systolic and the diastolic. So someone's going to hear blood pressure and they'll be wondering, what does that even mean in the first place? So let's get into a bit of anatomy, if you will. So the blood travels in vessels, right?
Okay.
Either in the arteries or your veins, right? So it goes from, your heart to your major organs through your arteries, and blood is returned back through the veins to your heart for them to be oxygenated and deoxygenated, as the case may be.
Okay.
So now, in the case of blood pressure, it's that pressure at which your blood flows through either your arteries or your veins. And you have it in two parts. You have the systolic and the diastolic. So now, in the case of high blood pressure that is recorded as high as 140/90. So any blood pressure reading you get when you put on a sphygmomanometer at any part of your body to measure, and you get any pressure in, and this many times is your arterial blood pressure. So there's the blood traveling in your artery. If it's anything higher than 140/90, then you are said to be hypertensive or you have high blood pressure. Meaning that anybody with blood pressure below 140/90 is normal, but specifically anyone with blood pressure below 130/80 is absolutely normal. So if you get 120-something/70-something, then you are fine. If you start to get 130/80, getting towards that 140, then it's a cause for alarm and you need to. Because what is important to know is that the blood must travel at that pressure, right? It must be at that stable pressure as blood is going from your heart to your organs, which means that if it goes at a very high pressure, there's a tendency to destroy those organs that it's going to, get to.
I see. But doctor, this is just an addition to that number one. I've seen different charts, indicating that the blood pressure actually depends on your age sometimes. That they will say if you're between a certain age and a certain age, you're allowed to have this. But if you're below that age, it's not nice. It's not nice. So can you shed more light on that?
So typically, as an adult, and by adult we mean that anyone that is above the age of 18, but in some individuals, depending on the body mass, which is another thing you must also factor in when calculating blood pressure.
Okay.
But standard as an adult, so an adult above the age of 18 that has a weight of anything above 70 kg. So the average adult should weigh at least 70 kg, should be above 18 years of age, should have a blood pressure reading below 130/80. So anything above that, we are getting to almost hypertension, and anything above 140/90 will not be, full-blown hypertension. Now, for children, it varies depending on age group. So for the newborns, we have a pressure almost likely a bit higher. Then when they become, when they enter like the early infancy period, it tends to lower down, and then as they grow up, it tends to increase. So normally you can get a blood pressure as high as 130 over something in a newborn, then it would drop. So you get blood pressure going to as low as 100 over 60, and then the blood pressure will pick up, and meet up to, adulthood. So that's really how the blood pressure goes.
I see. So almost every disease has symptoms. What are the symptoms of high blood pressure?
Unfortunately, high blood pressure has gotten this name that we call the silent killer, right? Meaning that many at times it is asymptomatic. It doesn't have any symptoms. It doesn't show you anything. It doesn't let you know anything. And so that's why we preach that it's important as an individual. There's so many pharmacies around. Walk into a pharmacy, check your blood pressure from time to time. It costs you almost nothing. Some pharmacies is free. Some pharmacies may just ask you maybe to pay about 100 or 200 or 500 naira, as the case may be. But I mean, what would it cost you to spend 500 naira to know your blood pressure than when you come into the hospital and then they have to tell you that you have something like stroke or you had a cardiac arrest, which is when you get to even understand that person actually, or see that person actually has high blood pressure. So typically, high blood pressure has gotten the name called the silent killer, and so it's asymptomatic. Usually doesn't present with any telltale symptom, but what it's important for any individual to note is that if you regularly check your blood pressure, it will not come as a surprise to you when your blood pressure is high.
Thanks for that. So what factors or what kind of lifestyle would you tell us enhances or enhance, as the case may be, high blood pressure?
So when we look at high blood pressure, we look at it in two folds. So we look at, of course, the modifiable and the non-modifiable risk factors. So let's start with the modifiable risk factors, because I mean by modifiable, they are things that are within our control. So firstly is your diet, right? Ensuring that you're eating foods that are rich in fruits and vegetables, and leaving all those fatty foods, all those junks, all those fast foods alone. Ensuring that when you consume your foods have low, very minimal salt intake, because the increase in salt is linked to hypertension. Because what that happens is that a lot of sodium chloride gets into your system. Your body tries to sort of save in those sodium chloride, and that allows for extracellular activity, and that pulls in a lot of pressure to your blood. So high salt consumption is not good and typically would predispose you to getting high blood pressure. So we've talked about diet. Next will be certain lifestyle, like for instance smoking. Smoking would increase your chances of getting high blood pressure. Also, not and when we talk about smoking, we talk about smoking in all its forms. So there's no form of smoking, because some people will now ask that, okay, what about shisha? Shisha is also in that WhatsApp group, right? They are all in the same they are all in the same WhatsApp group. So smoking, be it marijuana, be it tobacco, be it cigarettes, you name it. Any form of smoking can predispose you, to having high blood pressure.
Okay.
The next you want to talk about is your physical activity. So how much exercise are you getting in a day? You notice that a lot of people that have high blood pressure most times are generally obese, right? So they have a BMI that is obese, right? Okay. So typically they are always on the fat or on the bigger side. And many times what really causes that fatness or obesity for them is their sedentary lifestyle. So they are not usually active. So many times for them is they wake up in the morning, they get into their car, they get to work, they are seated all day. There's almost zero activity. In fact, from their bed to their car, it's almost like as if someone is even carrying them there. From their car to the office, they probably won't take an elevator or take an escalator, There's barely any physical activity. And so we always preach that an increase in physical activity would reduce your risk of actually getting hypertension. So all of these are as I said, modifiable risk factors. So ensuring that you're taking the right diet, stop smoking, ensure that you are not obese, right? And get a lot of physical activity as possible. Then, of course, the non-modifiable risk factors. Unfortunately, high blood pressure has been linked more to Black men than any other group of people. And so you find out that a lot of men, and no offense to my men, because I know some of them are already giving me bombastic side eye, right? And so no offense to my men, but unfortunately, studies have shown that the Black man is more at risk, at higher risk of hypertension compared to the white man, and even compared to any other gender. And
Why is that?
So we've not extensively been able to show what that is or share a link as to it, but that's what the studies have seen. But from clinical experience, what we've even noted is that even though a lot of people will say, oh, begin to check your blood pressure from when you are 40, we've started seeing cases of hypertension, high blood pressure, and even stroke in young men as early as in their early 20s.
Wow.
And so once you are 18, right? Once you've clocked 18, you should know what your blood pressure reading looks like. If you're the type that used to smoke, take a lot of alcohol and or reduce it, ensure that you increase your physical, activity. Ensure that you're within the normal BMI. And if you do all of this, you most likely will avoid high blood pressure or hypertension.
Incredible. So, doctor, I do know that every health issue has potential risks. So what are the potential risks and complications associated with consistently high blood pressure?
So just like with many, high blood pressure is a cardiovascular problem, right? And so one of the most common cardiovascular problems associated with high blood pressure is stroke, or what we know as cardiac arrest, right? So typically, you would have situations whereby you have people that would just go out and about with their day and just hear, oh, the person dropped dead, right? Or the person just fainted. Nobody knows what happened. The person was just okay, or the person was even dancing on the dance floor and suddenly just slumped, right? So that's cardiac arrest, or what we call stroke. So that's the number one complication, and that's the most common complication. In fact, many times our diagnosis of hypertension actually comes from stroke. So that's actually when we even for the first time find out that that patient was actually hypertensive. When such patients just slump, either they slump and they die, or they slump, and they are able to recover from that stroke. So they now have what we call, either they had partial stroke or complete stroke. But many times our diagnosis of hypertension actually comes at that point. Then other complications that can arise, of course, hypertension, because as I said, it is an increase of the blood pressure to the organs, right? So blood is traveling at a much higher pressure than it should. It will destroy all the organs. So think of every organ in your body, right? It can destroy every and all organs. So from your kidneys, right? There can be complete shutdown of your kidneys, and it can lead to things like AKI, that's acute kidney injury, or even chronic renal diseases, right? You can also destroy your liver, right? So blood traveling there can also completely destroy your liver. It can, of course, blood traveling to your eyes can destroy your eyes, right? So you have things like retinomas from high blood pressure. It can, of course, also destroy, your respiratory system. So think of any organ, right, that is in your body that is vasculated by blood, right? So blood traveling at very high pressure can actually destroy it. And more importantly, lastly, will be your brain. Don't worry, your head is not spared from all of this. High blood pressure can actually destroy your brain.
Well, I've heard some people, I want to deviate a bit. I've heard some people say, if you think too much, you will have high blood pressure. How true is that? Is that a myth?
Oh, no. So absolutely. Overthinking, overworrying, stress. In fact, and I think that actually poses a question to all those of us in the medical space, is that stress has been linked highly to high blood pressure. And let's face it, the stress in Nigeria and the stress Nigerian men face, or African men face, is higher than...
What about women?
Women also face stress, don't get me wrong. But men seem to face a higher degree of stress. And that may just be the link between why men are at higher risk of hypertension. So stress levels, overthinking, overworrying, overstressing about things that are really beyond your control. And, we always talk about the ABC of stress management rather. So we always say, avoid unnecessary stress as much as you can. If you know something is going to cause stress, something is going to make your blood pressure rise, avoid it. Learn to, accept that there are some things beyond your power, and you just need to live, accept it as a part of life. So you know that, oh, there's traffic in Lagos. There's nothing you can do about the traffic. Well, maybe one day we'll find alternative means of moving in Lagos, right? But because of there's traffic in Lagos, don't let that become a stressor for you. Learn to accept it, right? you are in a family maybe that has a history of certain medical conditions, it can also be a stressor to you, right?
Okay.
But you need to learn to accept it, that there are some things that you cannot change and you must learn to accept it. But if you know that there are some things that are stressors that you can avoid, then learn to avoid them. Owambe on Saturday is a stressor in your life. It's going to financially stress you.
That's right.
Avoid it. You don't have to go for it, right? So, yeah.
Oh, great. Now, how often do we have to check our blood pressure like we're drinking water now, so that we'll be sure that we have the shock against hypertension? So how often should one measure or monitor one's blood pressure, and at what time of the day is best?
So typically, I don't think there's any preferred time of the day, because as it is known, blood pressure varies from time to time, depending on activity. So blood pressure is more situated around your activity. So firstly is check your blood pressure, I would say typically in the mornings, right? When you get up, when you are, because you've just rested, right? And you're just awaking from rest. And so your body is still in a calm state. So you want to check your blood pressure around that time. Even when you go into the hospital, typically, if probably the clinic you were going to is on the 4th floor and you had to climb the stairs, once you come in, we won't immediately check your blood pressure, because we know that climbing the stairs is already a stressor on its own. So we would ask you, to take some time and catch your breath, right? You can check and that's what we call the resting blood pressure. Okay. You can also check blood pressure, when someone has immediately done a physical activity. So even understand to how high the person's blood pressure can get to. But typically for every individual, the blood pressure we are most interested in is your resting blood pressure. And you can do it best in the mornings. Now, in terms of frequency, how should you do it? Right. I would advise at least once a week. Anything more than that, especially if you're not hypertensive, then you are just overdoing it. But at least once a week should be enough. Anything that's going to happen within 1 week would have given you a telltale sign by the time you're checking the next week. So once a week in the mornings, I would advise is best.
Oh, okay. That's great. So let's quickly take a break. We'll be right back. Welcome back, and thanks for staying tuned. So, doctor, are there specific dietary recommendations, as it regards individuals' health status, or is just the recommendations are one size fits all?
Well, as they say, Peter is always going to be different from Paul. So for every individual, you must know your health status. You must know what applies to you. Don't go and say, oh, because Lagbaja does not exercise, you too, you won't exercise, right? So every individual must understand their health and body needs and tailor their lifestyle to suit their health and body needs. I'll give an instance. For instance, in my case, I would say for me, I know that I need to avoid alcohol. I need to avoid smoking in all its forms, particularly because number one is there's already a family history, right, of hypertension. And so when you want to compare me with someone else that probably doesn't have a family history, the chances are I will most likely have hypertension more than that person, right? So you must know yourself, your current health status, and you must also understand your family history, right, and know how it differs from a day-to-day basis. So I would say not one size fits all. Be open, to exercising regularly, eating the right diet, right, avoiding, all these negative things like smoking and alcohol. Also take into account maybe you were born into a family that has a family history of hypertension, and so you may be just at a higher risk. Or if you're already an African man, right, or an African by birth, then you are also at higher risk. So you must consider all of that when making your lifestyle choices.
Interesting. So, doctor, can you provide a bit of guidance, in recognizing the symptoms, particularly, sometimes we have emergency cases around us. Okay, so what are kind of guidance for people around, to handle such emergency cases?
So I would say that when someone slums around you, or when there is when there is a diagnosis of maybe cardiac arrest or possible stroke, the first thing you want to do is to call for help, right? Call for help. Try to assess if that patient is still breathing, try to check the airway and try to check the circulation. Many times when the patient has stroke, circulation may be cut off, right? So you want to, but most importantly is you want to call for help, right? If you have access to the emergency response number, you want to call that number. Also, organizations should be trained, individuals should be trained on how to identify someone that probably has had a stroke or had a cardiac arrest. It's also important that if you know that you have high blood pressure, right, your loved ones and even your colleagues know about it so that they can be at a lookout. Because many times what happens with stroke and even cardiac arrest is that sometimes it may have happened for up to 5 minutes without anybody even noticing. You just feel like, oh, the person is just sitting. So because some people can actually sit and slump, right? And you just think that, oh, the person is just on their desk and they are not just moving, but you wouldn't notice it. So it's also important that if you have high blood pressure, if you have hypertension, that, you know, your HR, your colleagues at work also know about this, so that in case of any emergency, they can intervene by calling for help and calling the necessary emergency response. And of course, organizations and even everyone should be registered with a hospital. You should have an emergency hospital close to you, that in case should there be an emergency, where you can quickly rush them in so that they can get the necessary first aid resuscitative measures administered.
Okay, I know that in Nigeria, we have a lot of doctors in the house, uncertified doctors. You know, everybody knows what, man, sister used, this is what she used. I know what this is a blood thinner. This one can thicken your blood, you know.
This one can flush.
This one can flush. Everybody has something to recommend,
yeah,
you know, at different times.
So
what do you have to say about such, you know, attitude to medical issues?
So, of course, everyone now, and thanks to technology and the era of internet, everybody's now Dr. Google, right? Everybody's a doctor by virtue that you will Google. And one thing I always tell my patients when they come in, especially for those that have Googled all things, is that unfortunately, when you Google things, right, Google and the internet picks up information, opinion pieces that many times have not been verified, medically verified by, you know, an expert. And so I can tell you that even if you Google chickenpox today, I'm sure you will see death as one of the side effects or one of the problems associated with something as easy as chickenpox. Right? So it's very, very important that as an educated adult, that you consult with a licensed and certified medical doctor or certified medical practitioner in Nigeria. Of course, it's easy to identify them. You can just ask them. If you don't trust the person that you're speaking with, you can ask them to show you their medical license. I always have a soft copy of my medical license on my device, which you can verify. And luckily, all the medical licenses always carry a passport size photograph on it with our full names and our full registration number, even our registration number, which you can verify on the MDCN portal. So it's very, very important that you speak all your health needs. You speak to a healthcare professional, a certified one. Don't go be Googling symptoms, because the truth is you can Google everything and there's not much you can make out of many of those things that you Google. I always tell people, because it worked for Labaja doesn't mean that it will work for you. So I give an instance. Because a patient says, oh, I've been taking this agbo jedi and it flushed my system and my high blood pressure went. Well, you don't know. Maybe in addition to that agbo jedi, which may just be a coincidence, maybe this person is a hard worker. This person exercises from morning to night. It's hawking, you know, plantain chips on traffic. When you, ordinary 10 minutes of walking, you want to collapse. This person probably does not even take any form of salt in their food. This person, when he's eating all the fruits and vegetables. If watermelon passes, they are the ones, you know. So take, for instance, you want to compare yourself with the aboki on the street who takes all the fruits, you know, they push all the fruits, that's all they consume, they eat it, they sell it, right?
That's right.
They are always active, they are always moving from farm, you know, to selling. Then you that is always sitting at your office, getting fat, asking Amina to stop by Burger King to get you, you know, chopper size burger or double beef burger, right? With extra cheese and filling, right, in it. And you want to compare yourself and you say, oh, is that agbo jedi? Unfortunately, that agbo jadi is just a coincidence. It's not the factor that actually did help to improve that blood pressure. So you
Right.
must know yourself,
Mm.
right? It still boils down to you must know yourself and then speaking to a healthcare professional.
Okay. Okay, doctor. So what are the available treatment options, for this ailment?
So the available treatment options firstly starts with lifestyle modification. If you're the type that takes alcohol, reduce it or completely stop it. Alcohol is not even sweet in the first place, but we'll not go into that, right? Reduce it or completely stop it. If you're the type that smokes, please avoid smoking, and smoking in all its forms. And thank God the manufacturers of smoking have said it that smokers are liable to dying young. So please avoid it. Stop smoking and smoking in all its forms. Ensure that every food you take has a fruit and a vegetable.
Okay.
Replace all those your carbonated drinks with water. Water should be your best friend.
Sing it again.
Make sure you are taking your 3 liters of water in a day. 3 liters of water in a day. I always tell people, you will never see me so far away from my water. Water is my best friend. Like, I'm always looking for water.
I got my cup in the studio.
So water should be your best friend. Replace all your drinking, any form of drinking, with water. Anytime you're thirsty, you need something, take a glass of water. Right? Ensure that you are exercising. At least get 10 to 30 minutes of physical activity every day.
Okay.
Somebody's going to say, oh, I wake up very early, I live in Ikorodu, I work in Ekpe. When you come back in the evenings, take a stroll. Replace all those sedentary lifestyle, like you want to walk to the bus stop. Instead of jumping on Okada or jumping inside Keke, walk to the bus stop. Use your 2 legs, use your Legacy Benz and walk to the bus stop, right? You want to go to the market, you have already called Uber or you've called Bolt. No, walk to the market. Take walks at intervals. During your break time in the office, if you're on the 11th floor or you're on the 6th floor, take the stairs down and take the stairs back up. That's a way of incorporating, physical activity into your lifestyle. And if you do all of this, you'll be sure, to actually achieving a healthy lifestyle that is free from high blood pressure. Then, of course, regularly check your blood pressure. At least once a week, check your blood pressure. Know what your regular blood pressure reading looks like. And if you check your blood pressure and you know that you are hypertensive, please keep to your doctor's appointment.
Okay.
Keep to your medications that you are on, depending on the class and grade of medications that you're on. Some medications are taken daily, some medications are taken twice a day and the like. But we know that many times when you're on these medications are for life. So it's very, very important that you keep to your medications, but more importantly, that you keep to your doctor's appointment, because with every doctor's visit, your doctor will assess the degree of hypertension to ensure that it's not getting worse and it's not destroying any other end organs.
Wow.
And I hope if you do all of this, you should be able to achieve a healthy lifestyle.
Okay, that's all time can permit us on the show today. Thanks for that expose on high blood pressure, Dr. Adora. I want to believe that if you love life, you will do your part in taking your health more seriously. So until I come your way next time, think health matters. Think Talking Health with Bunny. Bye for now.